And then here's a masseter, right? Went over that. And then the temporalis. And then that shows here. Now, that temporalis muscle is going to go underneath the zygomatic arch, right? So it goes through this opening right here. So that's why, you know, you can feel the muscle up here, then you lose it underneath the zygomatic arch. And then the pterygoids, like I said, the only really way you're going to be palpating those is to go in the inside of the mouth. All right, now I have one more on the axial spine. So then here's some of the landmarks that we talked about here. And we're not really going to get into, but we'll do later, the scapula and the ankle, the shoulders and things. And the spinous processes. And we'll get more into the muscles here when we talk about the muscles in the back. But there's the things that we talked about on the front here. What's this one right there? Jugular notch, right? Now, when you're palpating along the back, and you know, you're going to be doing a lot of stuff with back shoe points and things, so you need to have landmarks to know what level of the vertebrae that we're at. Okay. So you talk about, on the scapula here, we'll go over this more, but you have the medial border of the scapula, and then you have this is what's called the spine of the scapula right here, and this is the root of the spine of the scapula. So you'll be able to palpate that and then come across, and that's usually, let's see, I've got them marked.
T3.
Yeah,
T3.
So T3 is the root of the spine of the scapula. C7 is the base of the neck here. Usually C7 is going to be the most prominent one that you're going to feel on the back. Okay? As you're coming down the back of your neck, you feel one that sticks out the most. That's typically going to be C7. It's usually called vertebral prominence. Okay. And then if you can, it's a little harder to palpate, but T2 is going to be the superior angle of the scapula. But usually if you go for the root of the spine and you're going to be at T3, that's good enough landmark. But keep in mind that that's based on the person with their arms down like this. If they're laying face down and their arms are up like this, what's that going to do to the scapula? It's usually going to raise it up. Okay? And then you have the inferior angle of the scapula. It's going to be usually at T7. And then we talked before about you have the floating ribs. And then to palpate something like that, when you're sitting or standing, the muscles are a little too tight. So when we get tables out later, we'll go more into that. But basically, you know, you can try that on yourself. You can typically feel the tips of the ribs here, where they end. Okay. And then, of course, you know, when people say, you know, put your hand on your hips, you're going like this, that's really not your hip. That means your iliac crest. Right? The hip is going to be more into here. So the iliac crest is right on this area here, which is going to be this here. And then we'll get more into the details. You have PSISs and ASISs and different parts along that iliac crest. So now we have the spinous process, the transverse process, and the articular process. Now this is a lumbar vertebra here. It's pretty difficult to palpate the processes on the lumbars. You know, you can get this here, the spinous process, but between here and here, you got a lot of muscle right there. You know, like in chiropractic school, we had to do a lot of this spinal palpation stuff, so we had to do all that, find the transverse process and the articular process and things like that, but that's a different story. In the neck, though, you can feel the transverse processes, which are right out to the side here, and those are usually going to be pretty tender. Right? If you come right down straight from the mastoid, if you go right below the actual mastoid, you're going to feel the top of the atlas. So that's going to have this process that's going to stick out a little bit more. So you may be able to feel this boning process right here. And then as you go under that, then it jumps in, and there you're just on muscle. But if you come a little bit anterior to that, then that's where the transverse processes are going to be. They're not going to be straight lateral, they're going to be a little bit anterior in here. But you know, you're going through a lot of muscle right there, but you will feel some tenderness on those bony tips right there. Okay, so you know, you can start here in the center, and you can feel the spinous processes. Okay, those are going to be deep in the middle. Obviously, the C7 is going to stick out a little bit more. If you go directly lateral to that, what you're on there is what's called the articular pillar, and those are the articular processes of the cervical. It's going to be these here. So if you go to the spinous process right here, this flat part is the lamina, and then also the articular processes here. Again, you're going through a lot of muscle, so you're basically feeling through the muscle. So if you go away from the spinous process, then deep into there is the articular process and the lamina, and as you come farther apart, then you're going to get to the transverse process. That'll be around here. All right, so then now we're moving on to the sternum on the front. You have the jugular notch, and then as you come down the front here, so you have this angle of Louis, or the sternal angle. Like I say, usually there'll be a little bit of a prominence right there where you can sort of feel a transition of the angle. And then you just go down the front of the sternum, and then you have the xiphoid process. And then basically, you know, if you go down the midline, you're going to be feeling all the different spinous processes all the way through the cervical spine, thoracic, and lumbar. And then if you're on the iliac crest like this, and you go straight back in, your thumbs are going to be usually at the spinous process of L4, or sometimes between the junction of L4 and L5. So what you're feeling for is you're feeling for these spinous processes, and then you should also be able to feel the gap in between them. Right? So again, that's something that we'll be able to do better once we get the tables up. So again, here you're going based on the landmarks. Here you have the rear of the spine of the scapula. You can feel, if you follow the back of your shoulder blade, you can feel the root of the spine right here. And then here's what we talked before about the nuchal lines, and then going down to the C7, the vertebroprominence down here. And then when you're getting back up in the top here, if you go below the EOP, the sternal occipital protuberance, you go right down below there, you're not going to feel a spinous process. Okay? As you can see on the back, here's C2, that has a spinous process, C1 doesn't. So when you go back below this external occipital protuberance, it kind of dips in right there. That's where the atlas is. Then you come down a little bit more, and you're going to feel that spinous process. Okay, so that's going to be C2. All right, and then if you palpate, you can count your way down. It's a little tougher in the neck because the spinous processes are a little bit deep, but theoretically you could count all the way down to C7.
We're saying C1 and the atlas are the same thing?
Yeah, yeah. C1 is the atlas, C2 is the axis.